Welcome to the Medical Conditions in Sport presentation. This presentation will be supplemented by a Q&A session on your practical day. So if you have any questions, just make a note of them and bring them along to that day. Alternatively, you can also post any questions that you have in the discussion forum on Canvas. Some of the environments that people with asthma are going to struggle in are cold, frosty mornings, so particularly when it's middle of winter, if people are working outside or if they're competing in sport outside, then they're going to struggle a wee bit more. People who suffer from hay fever in the summer are also going to have exacerbated symptoms in terms of their asthma as well. And anybody involved in sport, typically towards the end of the warm-up where it's starting to get a wee bit more vigorous in terms of the exercise that you're doing, then they're more likely to suffer from issues then as well. And also if your casualty has any kind of infection, so if they've got an upper respiratory tract infection or cold, then their asthma is going to be worse. So if you see any of these signs or symptoms, then you should be administering 2 puffs on the blue reliever inhaler. Again, you can't really administer that per se, so it's your job to locate that for the casualty, give it to them and let them self-administer. If they're struggling to do so, then you'll put your finger on the button and help press it down. You're then just assisting to administer, not directly administering. You might want to consider using a spacer or an aero chamber, so a wee plastic tube that you put in the mouth. Inhaler goes into the end of that, press the button, medication stays in the chamber, and they can breathe that in over several breaths as well. So anybody suffering from an asthma attack will find it easier to use that. Also really useful for elderly people or for children as well. If you've administered 2 puffs in the inhaler and things haven't got any better after a few minutes, you're going to repeat that. And if things still don't improve, then you're going to consider getting the casualty to hospital, probably by ambulance. While the casualty is administering the inhaler, they should be sitting down, leaning forward, or sitting in the semi-recumbent position, so W position. So it's the same as what we're going to use for a heart attack, so you'll see that position in a few slides' time. It's important that you're aware of the different types of inhaler that your casualty might have. So if you have somebody with asthma in your workplace or in your football team that you coach, for example, then you should make sure that they've shown you that and shown you how it's used, so you can assist them in administering it if required. The calmer your casualty is, the less impact that's going to have on their breathing, so trying to encourage deep, slow breaths to prevent hyperventilation is important as well. And be prepared that if you have had to phone for an ambulance because things are pretty bad and the inhaler hasn't really made a difference, then you might need to administer CPR. So there's 2 different types of diabetes. So type 1 is insulin dependent, so it's generally established quite early on in childhood and it requires insulin replacement therapy. Type 2 diabetics, generally non-insulin dependent, so they're treated by potentially tablet-based medication or just through weight loss and diet improvements. So type 2 diabetes tends to be brought on later on in life just through poor diet, lack of exercise, and people being overweight. However, we're starting to see type 2 diabetes in young people even in late teens, early 20s because of the obesity pandemic. So if you see any of these signs or symptoms, then it's an indication that your casualty is having a diabetic hypoglycemic attack. So hypoglycemic attack is when the blood sugar levels are too low. Hyperglycemic attack is when the blood sugar levels are too high. It's more common for you to see hypo, for example, a worker maybe sleeps in the morning, they skip breakfast, that lowers blood sugar levels, maybe have to run for the bus or the train or walk pretty quickly into work. Exercise will lower blood sugar levels as well, and if they've had any alcohol the night before, that will lower blood sugar levels too, so you can see why somebody might get into trouble. The treatment for a hypoglycemic attack is to give your casualty something sugary, so something containing around 20 spoonfuls of sugar. So your wee party size cans, your wee mixer cans of Coke would have been ideal, so it needs to be the sugary one, not the diet one. Other drinks are useful as well, but you just need to be aware that the brand, other brands, most of them reduce the sugar content because of the sugar tax, so you might need slightly more of that in terms of the volume of it than what you would have done before. You're better to give your casualty something to drink because it'll empty out the stomach into the bloodstream quicker, which is where it needs to be to have an impact on blood sugar or blood glucose levels. Something carbonated, so fizzy as well, empties out the stomach a wee bit quicker. We would never inject somebody with insulin, so insulin lowers blood sugar levels. So if somebody's having a diabetic hypo, then injecting them with insulin will essentially kill your casualty. Most type 1 diabetics who have good control of their diabetes will be fitted with an insulin pump, which will just regulate the amount of insulin that's administered within the body. They'll also have a wee sensor that they wear on their arm, which they can scan with their mobile phone, and that will tell them what their blood sugar levels are. So there's not the same need for the finger prick test anymore to monitor your blood sugar levels. When we're talking about heart attacks, it's important just to differentiate between a heart attack and a cardiac arrest. So a cardiac arrest is an electrical problem with the heart, so all the signals that are sent to the heart are all jumbled up. Your casualty will always be on the ground, unconscious and not breathing if they've had a cardiac arrest. Heart attacks are a circulatory issue, so it's generally a blockage in the coronary artery, so the artery that supplies blood to the heart becomes blocked, and that will bring on heart attack-like signs and symptoms. Your casualty will most often be conscious at this point in time. So if you see any of those signs or symptoms in your casualty, it's important that you phone 999 straight away, and then you want to get your casualty into what's known as the semi-recumbent or W position, which you'll see in the next slide. So this is the semi-recumbent or W position. So if you don't have a wall or a car or something for somebody to lean against in a football pitch, for example, we might be kneeling behind the casualty and they're leaning against our legs or somebody else's legs, and we should at that point help them to locate any medication that they might have. So if they've had heart problems in the past, they might have been told to take 200 milligrams of aspirin, for example. They'll just put that under the tongue and let it dissolve. We would just locate that for them and they can administer that themselves. If they can't administer it themselves, then we shouldn't be providing it at that point in time. We need to make sure that we phone 999 and state to the ambulance that you suspect it's a heart attack. So angina attacks bring on the same signs and symptoms as a heart attack. The difference is angina is brought on by stress or exertion, and it should be alleviated with rest and administering the medication, so the GTN spray, glycerol trinitrate spray. So it's a condition that builds up over time, and it's just a build-up of plaque within the coronary arteries, and that will then cause blood flow and oxygen to be limited to the heart, so it'll bring on these angina-like signs or symptoms, very similar to a heart attack. So casualties should be put into the same position, the semi-recumbent position, and they should administer their own GTN spray, so they should 2 squishes under the tongue. Again, we can put our finger on their finger and help them push the button down. We're then only assisting them to administer if that's required. If an angina attack lasts more than about 7 or 8 minutes, it's not an angina attack, it's a heart attack. And if rest and medication doesn't alleviate the signs and symptoms, then again it's a heart attack, and we should phone 999 immediately. If the casualty doesn't have a GTN spray, then we've got to assume that it may be a heart attack. So if the casualty hasn't been diagnosed with angina, we've got to assume that it may well be a heart attack and phone 999. So a stroke is essentially a heart attack, but within the brain. So a stroke's either a blocked or ruptured blood vessel that supplies oxygen to the brain. So a blockage would be an ischemic stroke, and a ruptured blood vessel would be a hemorrhagic stroke. So the lack of blood or the bleeding results in damage, which can often be permanent to the brain tissue, and that could result in death or permanent disability in your casualty. Strokes can occur at any age without any warning. There are lifestyle factors that will predispose people to stroke, so having a poor diet, drinking too much, smoking too much. The key thing is the earlier intervention the better, so we need to phone 999, state that we suspect it's a stroke, ambulance will arrive and the casualty will be taken to a hospital with a stroke unit. When identifying a stroke, we want to use the FAST approach. So if you think of the F, the A and the S as 3 sides of a triangle, if any one side of the triangle is broken, it's time to phone for an ambulance. So the face may be drooping on one side in the casualty, they won't be able to hold both arms up over their heads. Speech will be affected as well, so they might be slurring their speech. If you see any of those things, we need to phone for an ambulance, state that it's a stroke. Hyperthermia is when the body is struggling to deal with warm conditions. So hyperthermia, body's too hot. Heat cramps, so that's the first stage. The symptoms are muscle spasm, fatigue. We just want the casualty to rest, stretch and take cool drinks. So it's common we see that in the end of football games, for example, they maybe go into extra time. Heat exhaustion, then body temperature started to rise here, so it's a wee bit more serious. So casualty will be feeling faint, loss of coordination, they'll be sweating massively for the environment they're in and the activities that they're doing. So we want the casualty to rest, we're elevating the legs, so essentially we're treating them for shock, we're monitoring airway, breathing and circulation, and we're applying ice packs to the groin, the neck and the armpit areas, so that's where they'll have most effect at cooling the body down quickest, and we want them to sip on cool drinks. Heat stroke is a medical emergency, we need to phone for an ambulance immediately, so that's when the body's getting to temperatures that it can't deal with. So the body will actually have stopped sweating, so it's essentially cooking itself from the inside out. So at that stage we're going to have to administer basic life support, so CPR. We want to cool the casualty down using the ice packs to the groin, the neck and the armpit area. We're treating them as a shock again, so if they're still conscious we're elevating the legs, but we need to be prepared that we might need to administer CPR here, and we must phone for an ambulance immediately. So hypothermia is when the body's too cold. So it's generally caused by cold, wet, windy conditions, and there's a gradual onset. So the casualty will be shivering, they'll be confused, there'll be a slowing down and loss of kind of coordination, motor skills. We want to try and remove them from the cold. If possible, we want to remove any wet clothing because that provides less insulation than dry clothing. We need to be careful and warm them up slowly. So warm, sweet drinks, no alcohol, maybe a bit of gentle exercise that will increase muscle temperature, and over time will have an impact on overall body temperature. But we need to be careful not to warm them up too quickly, otherwise there's a risk of cardiac arrest. And we want to monitor them on the AFPU scale, so are they alert, are they responding to a voice, are they only responding to pain, or are they unresponsive? And we should see them move up the scale towards alert. It should be getting better. If we don't, then we need to phone for an ambulance and get them to a hospital. The picture here is actually of mild allergies, so that's going to be pretty uncomfortable for your casualty. So itchy red skin, the minor local swelling that we see there with the eyes. The key thing is there's no breathing difficulties with mild allergies. I want to remove the cause if possible. That's not always possible to do, so we might need to remove the casualty from the environment that they're in, but reassure them, cool the area down, and advise them to see a pharmacist or doctor in terms of antihistamine medication, or they can purchase that a low dose of it over the counter. So severe anaphylaxis is caused by a severe allergy to things like nuts, shellfish, bee stings, latex. So you can see there the eyes have swollen so much that they've closed over, the lips are swelling, the throat will be swelling as well, and that will be kind of closing the airway over. At the same time, blood pressure is going to be dropping as well, so it's a two-pronged attack on your casualty. There'll be an initial tingling of the lips and the tongue, so that gives the casualty a kind of indication that they've come into contact with whatever it is they're allergic to. Speaking will become really difficult, there'll be a hoarse voice, they're going to struggle to breathe, the kind of red blotchy skin as well, and they'll be very, very, very anxious and this feeling of impending doom. Casualty will become unconscious if we don't administer medication, and it is fatal as well. So if we don't get medication into the casualty, depending on the trigger, whether it's a food trigger or a sting, so a bee sting for example, then the casualty will go into cardiac arrest within a 15 to 30 minute window. So if we don't do something and administer medication and we just phone and wait for the ambulance, casualty may not make it. The medication we want to administer is an auto-injector with adrenaline in it, common brand in the UK is an EpiPen. So we will do a wee practical on this, and you'll get a chance to use some of the training units on your practical day in terms of how to administer this. So we basically hold it like a dagger, we pull off the blue cap and we fire the orange end into the casualty's thigh. It will go through clothing as well. We just need to be careful not to hit like mobile phones, wallets or something in pockets. If we've ever administered an EpiPen, we must also phone for an ambulance. The ambulance will administer another dose when they arrive. Certain percentage of the population who have severe anaphylaxis will require two doses, so they may well carry a second EpiPen. If the first one hasn't been effective, then we can administer a second one within a 5 to 15 minute window. We are allowed to administer this medication under the prescription-only medication human use order of 1997, so that states whether we're trained or not, we're allowed to administer this for the purposes of saving life. Kids will have half the dose of an adult EpiPen, so up to about 30 to 35 kilos in body weight you'll be prescribed rather a kid's dosage. After that they'll have an adult dosage which is 0.3 3 milligrams of adrenaline. That's the end of the section on medical conditions. As mentioned at the start, if you have any questions, please make a note of these for the practical day, or you can post them in the discussion forum on Canvas.